One of the biggest topics in the news over the past few days is the debate over the Affordable Care Act and the new plan introduced by the GOP that would replace it. Today, Dr. Tom Rogers from Performance Medicine gives us his take on this ongoing debate.
Thanks. It's great to be here today at Performance Medicine, where we talk about timely subjects, hopefully, in the medical world. Today we're going to talk about something very timely, and that's what's going to go on with insurance, health insurance. I have my son Ben Rogers here today, who not only manages my practice, but he's a compliance expert and manages several doctors' offices and is really up to date on a lot of the stuff that I'm not up on. You know, with all the stuff about Obamacare disappearing and the new Affordable Care Act #2, Obama Light, whatever you call it, kind of give me your idea about what's going on, and I'm going to try to relate that to what patients can do.
Well, no one really knows what's going on. Of course, everyone saw, in the news yesterday about the new bill being introduced. It hadn't been passed yet, but no one knows what's going on yet. And they're looking at possibly expanding Medicaid. It looks like pre-existing diseases are still going to be still okay. But really, what I'm trying to push is that we look at it a little bit differently. We don't focus on whether or not we like it or not. We focus on how to be practical with what we have. And I feel like the media has spent so much time and effort on judging, the new bill or the old bill, instead of educating the public on how to best use your insurance.
Okay, I think that's a great point. A lot of my patients are really upset because it seems like this year in 2017 that everybody's insurance premiums went way high.
Right. And
their deductibles also went high. So a lot of the things that people see a doctor for on a routine basis aren't being covered.
Right.
In my practice, it's kind of a moot point anyway, and that's why I practice without taking insurance. I let the patient file their own so that I don't have an incentive to run up the bill or to run an unnecessary test. So it's worked out great for me for the last 10 years. But people need insurance, and my thought about it is, medical insurance should be for catastrophe almost. It shouldn't really cover your colds and things. Now, some people need that,
right.
But what do you think a person should do? Like get a health savings account or get a high deductible plan? Or
Absolutely. Most people are on a high deductible plan anyways right now. And if you are on a qualified high deductible plan, you need to start putting money into your HSA. If you're a high income earner, it's a tax savings. And there's a lot of things that you can do. Even for a low income earner, you can use subsidies. There's a lot of ways to take advantage of your health insurance. But really, what we're talking about is taking care of yourself and staying out of the ER, things of that nature. But you're right. Originally, health insurance was just for catastrophic things to keep you out of bankruptcy. And that's really what I think it should still be for. In the last 15, 20 years or so, people have used it as almost an excuse that the system's going to take care of me. I don't have to take care of myself because I'm paying this every month. The system's going to take care of me, and that's just not the case anymore.
I think it's very interesting what's happened over the last 50 years with medicine. My dad, of course, your granddad, was a surgeon, and back then I don't even think they really took insurance at all. I was talking with him a few years ago about the cost of an appendectomy. Back in the 1960s, it was $100 to get an appendix done. His fee, hospital fee, everything. Your brother, my other son Andy, got his appendix taken out last year in Los Angeles, and the bill was over $200,000. Right. So there's really not a lot of visibility, right, because what you get charged has no relation to what actually they're going to get paid. Yeah. So it's interesting in our practice that we do emphasize that you take care of yourself, have an affordable plan, yep, that you can utilize if you need it. But the most important thing is, guys, take care of yourself, prevention, so you don't have to utilize it too much.